how are you all doing? It is the end of week 7. Let's get this weekly recap video going here. And I am back and ready to hit it. So let's do it. All right, so first thing I want to cover is the goals portion. So last week, my goal was to continue my exercise progression and also push the range of motion on the flexion side of things. I know it's kind of a common difficulty for people with quad grafts to get that flexion going because you took a piece of your quad tendon out of there and it's really tight and it's healing and all that stuff. So that's a common difficulty there. So I had a goal from my doctor to reach 120 by end of week 7. And I pushed it pretty hard that week and I managed to get to 121 degrees by the end of the week, so that's pretty good. I won't have to have the doctor order me a machine or anything like that, so that's looking good for everything. I'll touch some more on the flexion, just kind of give tips in case you had the quad graft, or even if you had different grafts and you're having some difficulty with your flexion. I have some tips here in a little bit and another portion of the video. For the other portion of that goal, so my new exercises, I had a few new introduced this week, progressing a little bit. I'll touch that in a little bit here, but we got some new ones and I've been hitting them hard at home and at PT, so I'll cover that in a future slide here in a little bit. But yeah, I think for week 7, I think we hit my goal. Looking pretty good so far with that. And for week 8, my new goal is I'm going to try to reach 130 degrees flexion, and that's with using a strap during our heel slide, just passive range of motion, and we'll see if I can hit that. Really push my exercises to match my progression, make sure I don't stagnate. So there's some more, I'll touch on that towards the end of the video with my rehab and physical therapy and what's going to be going forward here for myself and my rehab plan. So stay tuned for that towards the end of the video. All right, so just thought I'd cover it here. I know if you're watching this and either just had surgery, looking at the future, what to kind of expect, and if you haven't had surgery yet, just kind of seen these videos. So I just want to touch pain level every week. Nothing too exciting here, no pain. Of course, if I'm pushing range of motion to kind of stretch it out further, there's discomfort, maybe even like low to mid-level pain, just depending on how hard you push it. Exercises, I'd say, when you introduce a new thing, so I'll get into it, but mini squats this week, maybe it's a little uncomfortable in the knee. I don't think it's so much pain, but just comfort, maybe like really low level pain. I think that's kind of common when you introduce something new, but yeah, I'll let you guys know as I push strength and that rehab portion even harder in the future weeks. But pain's pretty good this week. I will say, I know last week I had kind of an issue with pain behind the knee, and eventually towards the end of the week it popped and that pain went away. But this week I've been having every day pretty much, like I'll feel like, ooh, it's like I'm starting to do exercise in the morning. I'm trying to do a straight leg raise after doing some quad sets to get warmed up. And I'll feel like, this feels a little strange. And then once I get my leg off the ground with the straight leg raise on the first rep, usually it'll pop and it feels all good for the most part. I've also experienced while walking around, doing daily life stuff, I have noticed every so often my knee will pop. If I'm trying to really push the range of motion and walk really well with a good gait, it'll pop sometimes. No pain when this happens. If anything, it feels good. So just something I threw in there. And I will touch on the fact that my knee is still pretty stiff. I have noticed towards the end of the week, it's getting easier. Each day gets better with that. Really, it's in the morning. It's when it's difficult. You've been sleeping and, pretty much had your knee in one position for most of the night, or after sitting somewhere for a long time, if you're working in an office chair, sitting on the couch, whatever. The knee is stiff still, just is what it is. I think at this point it's kind of common, and just warming it up gets it loose and feels pretty good after that. But yeah, still got that knee stiffness going on. And so for the flexion work, I want to cover this a little bit more detail because this is really helpful for me, and I just want to pass that along to you if you're having issues with the flexion side of things. So I got to 121 degrees, like I said. There's discomfort, pain level maybe at 4 to 5 out of 10 when I'm really pushing that max range with the strap and doing the heel slides. I'm not really pushing beyond, 5 out of 10 pain, but I found that when I really, you got to push it to where it's just, not comfortable, because before that I was kind of staying within the realm of, it's a little uncomfortable, but not too bad. But really this week I got into that range of, oof, I can only hold this for, 30 seconds at most. And that's really me like, breathe in, counting slow, trying to take my mind off the pain. So yeah, it's not fun. I'll be honest, it's not fun, but you got to do it. You got to hit it. So for my tip, when you pull your flexion, you're going to get further and further with each rep. But so you do some, unassisted heel slides to get warmed up, maybe some active range of motion, just, doing a heel slide without a strap. And then, you move on to, after maybe 10 reps of that, move on to with the strap for some passive range of motion. So you're kind of assisting it and pulling it. And sit at your max range of flexion and then let it out a little bit after maybe 10 seconds, 20, 30 seconds, whatever it is, so you can hold it there. Let it out a little bit just to where there's no pain anymore, maybe a little discomfort, but no pain. And then pull it even further again, and you just keep on repeating that. And that's how I got my range of motion going pretty well this week, for my standards at least. So that's a tip that I'll pass on to you guys in case that's something that you're struggling with and need some help with. So that's what I did this week to help me. I've tried the wall slides, sitting in my office chair and kind of pushing it, and actively thinking about doing some flexion work while working in an office chair. So of course, do it as often as you can. You don't want to aggravate it too much to where swelling pops up and makes it all difficult again. But just try to work out as much as you can throughout the day. And those are my tips for that one. Exercises and walking. So this week I did introduce some new exercises with my orthopedic PT. We introduced mini squats, elevated calf raises, single leg calf raises at home. And we also did the stationary bike. At first it was like 3 minutes at a time. There's no resistance with this as well, by the way. No resistance, just free biking. 3 minutes at a time. Then my second visit during the week was like 6 minutes. And at home, I'm sitting around 5 to 10 minutes roughly, somewhere in there, just kind of working that range of motion is really what it's there for. And then also single leg step ups. That's kind of like the main new exercise this week that were introduced. Again, I've been doing these at least 3 times a day at home. And each time takes, roughly 45 minutes, give or take, depending on how many exercises you throw in with your set here, your routine. Because on the side of the slide here that I'm showing, there are quite a few exercises now in the rotation. I try to do the big ones like straight leg raise, sideline leg raise. Those are pretty easy to knock out. Doing the heel slides, working that mobility there. So heel slides is really good. Even like heel prop is kind of a newer one that we introduced recently because not as concerned about the meniscus repair being pushed past 0. Not that I'm really pushing past 0, but just to be on the safe side there. Calf raises, I'm really knocking those hard. My right leg is really weak. The right calf and quad and everything's really weak in there. So hitting calf raises, it makes walking easier with my stronger calf when I warm it up. Bridges are something I kind of already did, but didn't really do them too often because my knee range of motion wasn't great and it was hard to get good form and everything with a lack of flexion range of motion. So now that I got better range of motion there, doing bridges more. And then mini squats every day. I'm doing at least 3 sets of 20 right now, pretty much at home towards the end of the week. Single leg step ups, I don't really do them at home too much because I don't have a high enough stair that's gonna be stable enough for me. I don't really want to step on a block or anything at home because I don't really have good wide stable blocks. Single leg step ups, at first it was kind of mental challenge to get over, but after like the first one or two reps, it was pretty easy at PT. They have a good stair there for me to work on, and that's pretty easy actually, the step ups. Biking, I kind of mentioned, I do that maybe not 3 times a day, but I'll do at least 1 time a day. I have a bike at home that I can get on, and at PT we do it every time so far. And then like I said, the heel prop is pretty good, just to get that extension going. And standing banded knee extensions. I don't do them at home as much because I don't have a good thing to put my strap around. So basically you have a strap around like a pole, and then your strap around your leg and you just pulling your knee straight, knee extensions that way. I do them at PT a lot, but here at home I don't have anything really stable that's going to be good for me to get my strap around and all that. So just do other variations of knee extensions at home pretty much. And then walking. So I was cleared to start walking without any crutches at the end of week 6. And I've been walking without a crutch since then. The only issues with walking, I'd say at this point towards the end of week 7, is if my knee is stiff. So first thing in the morning, it's stiff. It's kind of, I'm kind of limping a little bit because I don't have good extension and flexion. So I'm limping a little bit. But if I get my range of motion going pretty good, maybe have my legs straight for a little while, some heel props for a couple minutes, do some heel slides, and then I am golden with walking. So that's pretty encouraging. So just making sure the knee's not stiff and maybe warm up the muscles a little bit. Weak muscles make it hard to walk, of course, but at this point, that's not as much the issue as the range of motion side of things. So that's going pretty well. And now for kind of the last topic I want to cover this week, Rehab Guidance. With my orthopedic PT, it's nothing personal. They're great people there, very friendly and great to work with. But I will say I feel like they're not pushing me as hard for kind of like the sport aspect and really pushing my progress along at a quicker pace. I feel like there is more of a functional physical therapy, just getting back to normal life. But I want to get back to playing sports, running at a little bit higher level. Not that I'm a experienced runner, just being able to run like long distance, soon again and all that stuff. So just getting back to my like active lifestyle. I feel like they're kind of, I don't know, not pushing things, and I'm kind of stagnating because I'll do stuff at PT and it feels like, yeah, this is pretty easy now. Let's kind of progress things a little bit maybe. And we're doing kind of the same stuff over and over. It's not really progressing as fast as I was hoping. Whether or not that's the right thing to do from a rehab perspective, I'm not too sure. I'm not a therapist, I'm not a doctor or anything like that, but I just feel like it should be progressing a little bit quicker. I see people that I know who've had surgery recently, and they're progressing at a quicker pace than me. They're pushing it harder at rehab, and it's just something that's been kind of coming up in the last few weeks that I've been frustrated with, I'd say. So again, there's that side of things. There's also no clear direction on like home exercises. This past week, I've asked my PT at the orthopedic organization that I've had a surgery within. I asked him, how many rest days is this rehab type of thing? Is this something that you should really do if you're going through rehab, rest days? I know maybe once you're further along with, strength training portion of things, maybe you have rest days, but right now I'm not really too sure. And he had to ask what I'm doing at home because he thought I was just doing straight leg raises, heel slides, and quad sets at home. And, I've been doing like my whole list of exercises like 3 times a day at least. And I don't know, it's a little disappointing that he didn't really know what I was doing, as well as the fact that they don't give me clear guidance on what I should be doing at home. So if I was only doing those 3 things at home, I would not be where I am right now. Not that I'm, really far along, really, in the grand scheme of things. I feel like, there's other people who are farther than me at this timeline. So that was disappointing to hear, when I was asking that question this week. And I don't know, like I said, I'm just kind of stagnating. So this week I also, towards the very end here, the last day of week 7, my PT at the very end was like, yeah, we probably could do the leg press today, but we'll wait till next week. And I don't know, I just feel like they wanted me to get out of there. Nothing, again, nothing personal with these people. I like them a lot. I feel like they're not really motivated at the same level as me to kind of get through rehab as strong as possible and as quick as possible and kind of achieve, higher standard goals with this rehab process. So with that being said, starting next week, I'm going to be working with elite endurance physio. There's Josh Smith there. I worked with him for, run coaching. He helped me run my first marathon within this last year. And he's a great guy. He's a great physical therapist. He's he does this running coaching inside of his normal physical therapy job. And, I trust him a lot. I like working with him. And he has rehabbed ACLs a lot already, over the course of his career. And I know that he's going to put in the same motivation that I have and kind of help me progress along in a much, a better pace for, my standard of, activity levels, I guess. So I'm really excited about that. We're going to get working next week. He's going to kind of evaluate my knee to see where I'm at in person. And we already have monthly goals set up. So using Training Peaks, he already entered a bunch of goals for each month, kind of milestones and where I should be heading towards, which is way more than what my orthopedic PT has done with me. I'm pretty lost with them. They don't even really tell me about goals and timeline, which I know is kind of really individual. So next week I might share some of these goals that I'm going to have with my elite endurance physio PT, Josh Smith. But again, they'll be pretty individual. So don't take these, word for word and copy. It's going to be very, based on the individual. But I already got these goals lined up. Once he looks at my knee and kind of assesses like where things are at based on, my progress so far, we'll get going with some daily exercise goals, what I should be doing every day, and they'll be updated weekly, and he monitors my progress and all that stuff. And I'm really excited for that because I know he's a very, very good PT. He's very motivated like myself. He's, got high standards. So I'm really looking forward to working with him. And I think, within the next month, I think we're going to see a lot of progress that I don't honestly think that I would have had with this orthopedic PT. So we'll see. Be interesting to kind of get that recap going over the next couple of weeks, and we'll see where I'm at. Also, throw in here real quick, I started driving at the beginning of week 7. I know in the last video, week 6, I said I'm cleared to drive again. So I've been driving and getting back to daily life. I'm mowing the lawn now outside. We just moved into my new house with my wife. We just moved in right before my surgery. We got kind of like the bare essentials set up. There's a lot of boxes around here. There's a lot of stuff to do. So I'm, doing that kind of stuff again, putting furniture together, hanging things up. So slowly getting back to the normal life as well. So I'm pretty excited about that. And real quick, I forgot to mention, guys, that this week I also got fitted for a sport brace for my ACL. So I'll put a picture of that right here. I think that's from further out, when I'm back to playing sports and whatnot, they recommend wearing it, maybe playing soccer, things like that, where, you're at a higher risk for tearing your ACL. So I got that this week, got fitted up. I'm sure there'll be more to come with that once I'm able to use it, and I'll let you guys know. So yeah. Yeah, guys, this is the end of week 7. I think week 8 video is going to be pretty exciting with my Josh Smith at Elite Endurance Physio. So definitely check in for that one next week. I'm pretty excited about that. If you could, like and subscribe. I appreciate you guys watching, and have a good week.